she's a registered social worker and will speak on sex in the time of COVID-19. Dawn, the floor is yours.
Good evening and good morning to participants from different parts of the world. My name is Dawn. I'm representing the research team of the Department of Social Work and Social Administration, the University of Hong Kong, to share the findings of a cross-sectional study entitled Sex in the Time of COVID-19, examining the sexual behavior and sexual desire of female adults in Hong Kong. Amidst drastic lockdown measures that were being adopted worldwide to contain the spreading of COVID-19, there were concerns of whether such measures would bring more harm to individuals and families who were already living in fear of being infected. However, there were also studies showing that women, particularly those who are either married or have a stable partner, were sexually more active and had stronger emotional bondings with their partners, despite limited contact and interaction due to social distancing and other pandemic control measures. The objective of the studies was to examine any significant changes in sexual behaviors and sexual desire of adult females in Hong Kong during the pandemic. Between July and August 2020, our team have conducted a cross-sectional online studies and recruited 602 Chinese female adults from Hong Kong through social media and community networks to examine their sexual behaviors and sexual desire. The measurements we have adopted include the Desired Domain of the Female Sexual Function Index, FSFI, and self-reported frequency of sexual behavior before and during the COVID-19 pandemic. We have conducted t-tests and one-way ANOVAs to compare sexual behaviors and sexual desire across demographic groups. Results have demonstrated that during the pandemic, not only was the frequency of having sexual intercourse became lower, the participants also did not feel sexual desire or interest as often as before. In fact, a low degree of sexual desire or interest was reported. Significant findings are being presented in Table 1. We have also performed linear regression with sexual behaviors and sexual desire as criterion variables and demographic characteristics as predictors. As per presented findings in Table 2, linear regression analysis has illustrated statistically significant reduction in frequency of sexual intercourse during the pandemic with increasing age and being single with or without partner, after taking into account all other demographic characteristics. Contrary to general belief, property ownership, property type, and residential surface area did not significantly predict the sexual activity or desire of this group of participants at all. So based on our findings, we've concluded that the pandemic did have a negative impact on the sexual lives of adult women, particularly for older women and single women without a lived-in partner. So moving forward, we believe that current findings could give insight to different stakeholders to develop sexual health counseling services to address the negative effect on sexual intimacy arising from sexual behavior change due to the impact of COVID-19 pandemic. Last but not least, we welcome your comments, feedback, and questions. We look forward to a robust discussion with you. Thank you very much.
Okay, thank you, Dawn, for this poster on sex in the time of COVID-19. I will wait for some questions from the floor. In the meanwhile, I have a question for you. These women that you took a survey, were these women with wish for a child?
Sorry. They are actually either single without partners, and there are some who are married with partners with children. Yeah.
So they were not trying to conceive.
Not in this studies, as in the data that I have. Yeah.
Okay. Okay, great. And the So you looked at single women with and without a partner. What do you mean by single women with partner?
Actually, some of them they cohabited with their partners, or some they actually have either casual relationship or have a committed partner. Because I think because in Hong Kong the context in terms of living environment, most of them they either live with their family members, or they could be single but renting a place of their own. And when I say renting a place, it could be some shared apartment with a few others housemates. So this is the general living condition in Hong Kong, which is why there was one point I mentioned about that. Surprisingly, when we try to do the predictor and correlationship to check whether housing environment and living environment have any prediction to their sexual behavior, but it turned out it did not. So that was also something surprising for me as a Singaporean, because in Singapore, our housing living arrangement is environment is very different from Hong Kong, and it's quite usually our living space per we use by square meter area is much larger than Hong Kong. So to me, it's something that I learned through this study. It's very different, although there are similarities between these two cities, which researcher often will compare the two cities. Yeah, that is something interesting that I keep in mind. Yeah.
Okay, yeah. Very well. Another thing that I was wondering about, I don't know how it's in Hong Kong and Singapore, but here in Belgium, we have a really COVID-19 baby boom. So yeah. Wow. So, but maybe between the married, not the married couples, but the women with partners. And indeed, it was surprising. Because you stated that the sex life deteriorated. So can you elaborate a bit on that?
I think for this study, I think that there are some limitations, because the responses we had mainly women who have access to internet, because we actually recruited our group of participants mainly through social network, through bulk emails. And when I was doing my data analysis, I noticed that those who have secondary and below in terms of education level, only I often I could not remember the percentage, but I remember when I checked my raw data, it was a very low percentage. So my team and myself, we were just wondering whether this would also have an effect on the actually the result that we presented. So it could be a bit skewed towards to a certain degree. We might not be able to access to those group of people who actually they might be still, continuing their sexual life as usual, regardless of the strict. Because I suppose some of the panelists might know that Singapore and Hong Kong have one of the strictest COVID-19 safety distancing regulation. Yeah, in fact, in Singapore, it's even worse. It was even worse that you actually could be fined and could be slapped with some charges. Police charges by visiting your people who are not your household member. For example, the boyfriend going to visit a girlfriend. It happens. It really happened throughout the years during the pandemic lockdown. So this will be one way or another affect the so it does not really come in surprise to me when you share that in your country there's a baby boom. For us, is no, you will be caught and people will just call the authority and you will be exposed. Even you are just trying to visit your partner to see them.
I think there's a great difference between countries in measures of
correct.
sticking to the rules or not.
Yeah.
Okay, thank you for your comments. I have one question from our attendees. Norway has also experienced the COVID baby boom, but these are partnered people. I wonder if those seeking abortions are the same or less. What do you think?
That part I probably would not really have any understanding on that. For me, from the medical social work's perspective, actually, I'm very concerned about their well-being, because I have been providing counseling service and support for females who encounter fertility issue, and some even have difficulties in terms of sexual intimacy. So this topic actually kind of really bring me back to the key point of how, as a healthcare professional, we come together to support them. But that is also an interesting question about people who are in the other group, like the abortion group. Unfortunately, our study, we did not have a question to ask about whether do they have are they seeking abortions or stuff along that line. Yeah. So this is another limitation when we design our questionnaire. Yeah, yeah. But that's a very good point. I should reflect to the team, maybe in our future studies. Yeah, because we are still having COVID-19. We are still in a pandemic. So actually, new studies can be designed from here. Yeah, and also the lovely presentation by the rest of the group, which could also give us some ideas. Yeah.
Okay, thank you, Dawn.
Thank you.
So, what is the main key message here from your talk? Can you summarize for us?
My key message is really to work as a team to look into the gaps and also the needs of the group of people who actually under very strict lockdown measures. Their not just their sexual life has been affected, their mental health would be affected as well. So I hope that we can advocate for some services to be launched within the next couple of years, because as I mentioned a couple of minutes ago, the pandemic is still ongoing. The impact on the different aspect of individuals' life will still be felt. Yeah. So
okay,
that's my message. Thank you
Thank
very
you,
much.
And one last question, sorry.
Sure.
And what do you think this means for our services, our fertility services? These trends in sexual behavior during the pandemic. What does this mean for regarding counseling, regarding treatment seeking? Do you have an idea? Just your thoughts on it.
I guess we should have more conversations between it's not just within the society itself, in fact across different culture, because the different cultures would have different I mean, probably over the impact on mental health. A lot of studies have already proven that mental health would be a key issue, and specifically for this group of people. In terms of like in Hong Kong, and both even in my own country, Singapore, my home country, the fertility rate has been very low. And then on top of this, with all the impact they are facing long lockdown and having mental health challenges and fertility issue. So I think we can work have cross national kind of conversations to actually come up with more studies to actually advise the stakeholders accordingly. Yeah, that's my little
perfect
idea.
Dawn, thank you so much for your
thank you very much.
Your cross-cultural knowledge and thoughts and experiences on this topic.